Shoulder pain is extremely common. We're seeing a lot of shoulder pain in our youth, particularly our youth athletes, and we're seeing a lot of shoulder issues in our older population. And part of that is, as the population ages in general, rotator cuff tears have just become ubiquitous.
If you experience shoulder pain, it's important to keep track of the cause and symptoms.
The two most important things to pay attention to are the acuity, so did it happen all of a sudden or did it happen gradually? And then the dysfunction. Can they no longer lift their arm where they could before? If you have an acute injury and dysfunction, then you've got to worry that something's wrong.
There are many common causes of shoulder pain. The muscles and ligaments and tendons and bone in the shoulder can all cause pain in one way or another. Any of those can be debilitating, but the probably most common causes of shoulder pain are arthritis, rotator cuff pathology or rotator cuff problems, and trauma.
There are many treatments for shoulder pain. Conservative treatments usually consist of physical therapy, sometimes pain medication. We also give injections. If surgery is indicated, we do arthroscopic surgery, which is minimally invasive surgery, done with a camera to repair things such as a torn rotator cuff or torn ligament. We also do joint replacement surgery for arthritis.
Hi, I'm Tricia Trink, and I'm a physical therapist with Seabreeze Physical Therapy. And today I'd like to talk to you about some stretches that you can do to help alleviate some neck and shoulder pain that you might be finding that you have. You will need the following materials. First, we're going to start with finding a corner so that you can do the first stretch, which we call a corner stretch. We're going to start by having our patient lean into the corner area, first squeezing the shoulder blades and then feeling a nice gentle stretch on the front of the shoulders, holding for 10 to 15 seconds, making sure you're breathing and not holding your breath, and then relax back. We often get very tight in this area because of the way we sit throughout the day, either with our arms in front of a computer or driving or any activity that causes our arms to be forward. Next, we're going to be doing another stretch that's going to work both the shoulder and the neck muscles. So we'll start by having the person cross their hands behind their back, gently lifting the hands off of the buttock region and tilting the head to the right side to start with, while gently pulling down onto the left arm, feeling a nice, very gentle stretch on the left side of the neck area. Again, breathing into this position and holding for 10 to 15 seconds, repeating 2 to 3 times each side.
Common surgical procedures for the shoulder can be broken down into two main categories. The first would be arthroscopic or minimally invasive surgery, and those types of surgeries are good for people with impingement syndrome or bone spurs, with rotator cuff issues, and with several other specific pathologies that we can treat with just through a couple of very small incisions, minimally invasive. The arthritis procedures are more likely to be treated with an open operation, meaning that a small incision actually has to be made, and it's not done through the minimally invasive camera procedures, and those would include the shoulder replacement and reverse shoulder replacement. There are several different types of those as well, depending on the type of pathology that we identify. The total shoulder replacement is a prosthesis that's implanted into your upper arm bone, and also a prosthesis that's attached to the socket part of your shoulder, the glenoid, where we're basically resurfacing an arthritic joint, shoulder joint, that has worn down over time. A reverse shoulder replacement is also a joint replacement that involves a prosthesis put into the upper arm bone and the socket part of your shoulder. But what we're doing in that procedure is we are treating a patient who does not have a functional rotator cuff. So in order to do so, we're actually reversing where the ball and the socket are. So the ball on the outside part of your shoulder and the socket on the inside part are actually reversed, and the socket goes on the outside and the ball goes on the inside when you're performing that procedure. And the prosthesis is designed to accommodate that.
Gentle stretches to increase your range of motion while your shoulder still hurts. A towel and a stick or cane is all you need to do these exercises. When doing any exercise, it's important to listen to your body. Use smooth, controlled movements. You should feel a gentle stretch in your shoulder. Stop if your shoulder starts to hurt. To do an overhead arm raise, lie on your back. Take hold of the wrist of the arm that hurts with your other hand. Slowly lift the arm overhead. Hold for 5 seconds, then lower your arm. Repeat 10 to 20 times. Do this 2 or 3 times a day. This is another stretch that uses your good arm to guide the arm that hurts. Stand up and put a small rolled up towel between the elbow of the arm that hurts and your side. Hold a cane or stick in your hands with your elbows bent 90 degrees. Push gently on the cane with your good hand to move the painful arm to the side. Be sure to keep your elbows bent and your upper arm close to your side. Stop the movement just before it starts to hurt. Hold for 5 seconds and return to the starting position. Repeat 10 to 20 times. Do this exercise 2 or 3 times a day. Pendulum swings use gravity to exercise your shoulder. Hold on to a table or chair with the hand of the arm that doesn't hurt. Bend forward a bit so your sore arm hangs straight down. Move your legs and hips, not your arms, to create the movement that lets your arm swing. Use the momentum to move your arm back and forth like a pendulum or an elephant's trunk. Then switch to making circles. Start with small circles and make them bigger as your pain allows. Repeat each swing 30 times. Do this 2 or 3 times a day.
Switch the crossing of your legs if it's comfortable, and stretch your arms back up towards the sky. Left hand catches the right wrist, pull up on the wrist, and gently side bend over to your left. Release your left hand all the way down to the floor. Keep reaching up and over the ear, softening your left elbow and drawing the shoulder down your back. Allow the right hand to reach all the way across to your left knee. Slide your left hand directly behind you. Sit up tall on a deep breath in. Exhale, twist deeper. You want to soften both shoulders, both elbows, so that you can keep the chest open and lifted as you twist.